Good afternoon. Thank you for joining the Student Health Insurance 101 workshop. We're still letting a few more people join, so if you could just be patient for another 30 seconds or so, that would be great. If you have any questions, you can put them in the Q&A for after when we're through. We'll go through and answer as many as we can. For those that we cannot answer today, or if they're too specific, one, you can make an appointment to meet with us one-on-one if it's personal. And two, we will be putting together an FAQ of all related questions and sending out a PDF to you as a follow-up. And also regarding follow-ups at the end, afterwards, you'll be receiving a survey questionnaire. It'll take you less than 30 seconds. It's probably 4 to 5 quick questions, but it will help us know if this was beneficial for you, if it answered your questions, if not, what we could have done. And also if you want a deeper dive coming up in the future. So we would appreciate any input. Thank you so much. And we will start momentarily. Good afternoon, and thank you for joining us and taking time on this gorgeous day to join the Student Health Insurance 101 workshop. It's an exciting afternoon filled with all things insurance, and hopefully you will feel like it was worth your time and that you learn a little bit more than what you learned before you joined us. My name is Karen Balo. I'm the Assistant Director of Student Health Insurance here on Morningside, located in John Jay. I have with me Cynthia Razzo, who's the insurance specialist. She is with Morningside and also the contact for Teachers College. In the background, we have Steve Veach. He is the senior insurance specialist, and he'll be anxiously awaiting your questions after we go through the workshop. So what we're going to do today is focus on high-level insurance basics. Most of you on the call probably have the Aetna student insurance plan. If you have your own plan, but you're just curious to know about insurance, that's great because the basics will be helpful, even though your plan may work a little differently than the Aetna student health plan. So with that, we are going to take a little dive into insurance. So at Columbia, the wellness of our students is extremely important. We have more than 70 resources available to students on campus that are beyond just your medical insurance. You can access resources that pertain to sleep issues, tobacco cessation, sexual orientation and diversity, eating issues, how to manage stress, anything that prevents you from feeling like you are truly thriving in every component of your being here at Columbia. So the number of resources probably goes to over, I think it's around 77. And if you look at this screenshot, you'll see how they're all interconnected in order to fall under Columbia Health. There is medical services, SVR response, counseling, psychological services, disability. Alice Health Promotion covers a whole gambit of resources. And then, of course, there's us, the insurance office. So what are we and why are we here? The student insurance office is not here as Aetna employees. We are Columbia. We are all about Columbia University and the students. We are here for you. We're here to help. We're not employees of Aetna. We're not pushing their plans. We are here to assist you in understanding their plan, in utilizing your insurance. We can answer questions about coverage, how you can obtain a referral, what to do about a claim that wasn't properly processed, right on down to the all basic question of where can I find my ND card? So we are here as a resource to you. And if you take nothing else away from this session, take away how to contact us and definitely utilize us as a resource going forward to make the most of your experience with all things wellness. So with that, I want to dive into how to best understand your insurance and how to use it, because it's not easy. It's complicated in the United States as far as what it's all about. And typically when people hear the word insurance, they run as fast as they can the opposite way. So we want to make it so it's less threatening or intimidating and more user-friendly. Insurance basics, starting off with the Aetna Student Health Plan, it's what we call an open choice PPO. And what this means is that you can select your own provider within the Aetna network, within the network that has participating doctors, hospitals, urgent cares that elect to participate and partner with Aetna at a lower cost to you for the services. If you have a medical concern or condition and you need to connect with a provider to establish baseline care, you're going to want to make an appointment at medical services and have a consult with a provider, because all care starts at medical services. And you can make that appointment basically by going to your patient portal and setting it up there. There is another option, which would be to call them directly. So whatever is more convenient for you. They will partner you with somebody who has the skills that relate to what your condition is, or you can just pick someone on the team who you feel looks like they might make a good partner for you in your routine care. So all care starts at medical services. From your routine care to minor urgent care to travel medicine, immunization, sexual health, LGBTQ, and even confidential HIV testing. You can access acupuncture and sports medicine services. You can receive, you're going to receive your referrals for off-campus specialists at medical services. They're located on John Jay on the 4th floor, and they are a must stop for obtaining that referral for off-campus care. So the question is, why do I need a referral? You need a referral because that ensures that you're seeing the correct type of specialist for whatever it is that's ailing you. Somebody who's qualified, somebody who's reputable. You can't just self-diagnose and say, I'm going to go to a specialist. You need the okay or approval or suggestion or whatever you want to call it from your primary care physician on campus. If your doctor does not feel it necessary for you to seek off-campus care because they can handle whatever it is on campus, then there's no need for a referral. But you need to reach out to them first, not after the fact. A referral basically, in a sense, it's stating that you saw your PCP, they believe you need somebody who focuses or specializes on the type of treatment that you require, and they will send you to the proper person. This needs to be done in advance because we cannot retroactively, we can't predate any referrals at all, and neither can the doctor. So now what I want to do is move into some common words. I think I just threw out a bunch of them at you, and there are so many more. But these are the primary words that are frequently used around medical services or on campus or in the insurance office or basically in real life. A premium is the amount that you pay in order to have access to your plan. It's a fixed cost, and whether you use that plan or not, that's what you're paying to be, quote unquote, a member of the plan. If you don't use it, it's not like you get that back because you're paying to protect yourself for what if. A co-payment, on the other hand, is what you pay when you're referred off campus and you go to a specialist. It's the charge when you walk in the door. So if you went to your PCP and they said, yes, you need to see a dermatologist, I'm concerned with what's on your back. For a consult, you're going to pay a copayment of $30 at check-in. And that's the charge that the doctor has to see you beyond what their basic cost agreement is with the insurance company. If you're going to a mental health provider off campus, you're going to pay $20, which in the grand scheme of things, if it seems like a lot, I can tell you that mental health providers in New York don't often take insurance. And when they do, it's far more expensive. These amounts apply to any visit that would be pertaining to an off-campus situation. If you have to have a outpatient medical procedure, a surgery, or a hospitalization, these procedures typically involve multiple individuals or specialists in the medical community. You may have a doctor, an X-ray, an anesthesiologist. Coinsurance is the percentage that you're required to pay for the total cost of that procedure. It typically applies to hospitalizations and more advanced procedures as opposed to the copayment, which is the in-office visit. The coinsurance with the Aetna Student Health Plan, if you are in network, you would be on the hook for 10% of the total, whereas Aetna needs to take over 90% of that total cost. So even though it seems like a lot coming out of your pocket, it's actually a pretty rich plan. A deductible, there is no deductible for the Aetna Student Health Plan if you are in network, if you're seeing an Aetna provider. If you decide you want to go to your favorite doctor, but they are not a partner of Aetna's, you would be on the hook for the out-of-network cost, which will be notably higher than the negotiated rate, as well as a deductible. The deductible for out-of-network cost for Aetna is $600. So it does make more sense if you do have the plan to find an Aetna doctor, which should not be difficult because they are a nationwide network and it's a vast network. Moving on to some more common words. I mentioned PCP a lot, and just to back up to make sure that you understand what a PCP is, it's a primary care physician. All care begins on campus at medical services with your PCP. This is your main provider. Sometimes this provider might be referred to as a general practitioner. In real simple terms, it's your doctor. It's your go-to. It's the person who knows the most about you. It's the person who you're going to see and say, I think something's a little off. And they're the one who is going to determine if you need to go off campus for a referral. A referral is required by the plan. If you haven't heard the word, I'm guessing you haven't had the plan because everything about the Aetna student plan revolves around this referral, which you get at medical services or it gets set into your account in your patient portal where you can access it if you need a copy. And it also goes directly to Aetna once it's written by the doctor. Referrals cannot be backdated. They cannot, once they're written, they're in your account, and Cynthia's going to go over that shortly. But a doctor or student insurance or anyone else is not allowed to backdate a referral if you forget to get one, because insurance is highly regulated and it is prohibited. So make sure if you go to any care off campus, except for, say, routine gynecological, that you remember to get this referral. It's a written order that states from your doctor that you do need to see someone who specializes in what's going on with you. If there's an emergency, absolutely go to the urgent care, absolutely go to the ER for treatment. But if you are discharged and they say you need follow-up care, go to medical services, reach out via email to your primary care provider, get a referral from Columbia. Do not rely upon the one from the ER because it's not going to count. In network and out of network, the difference is in network, you have a group of providers, doctors, hospitals, etc. They're contracted with the carrier. In this case, for us, Aetna is the carrier. So the doctors have a contract with Aetna and they provide service at a discounted rate. Depending upon the provider, you're going to have different networks. Aetna Student Health is an open choice. They are a nationwide network. And if you do have to go overseas internationally, if you save your receipts and your discharge papers and documentation, that actually can be filed as well as in network because there is no network internationally. Out of network care, you're going to pay more because there is no negotiated rate or partnerships with the providers that you're seeing. So I know that's a lot of information, but I want to turn it over to Cynthia now because she's going to put together how the information I just provided works with the basic student health plan.
Thank you.
Cynthia?
Yes, thank you, Karen. Okay, so now we understand, or we hope you've been introduced to this basic insurance terminology. We're going to apply that to your plan. So if you're new to the plan, if you've been on it but still don't know how to use it, all of those terms that Karen just used are showing up here. So if you're on the Aetna Student Health Plan, these are your copays and these are your co-insurances. First and foremost, if you are seen by a physician at medical services or someone at CPS, it is at no additional cost. If you get a referral from either one of them to be seen off campus, there is always going to be an associated cost for most services, I should say. If you go to an in-network physician, that is a $0 deductible. And what Karen went over, the deductible is an amount that you'll have to pay before the insurance kicks in. If you go in network, it's $0. The insurance kicks in immediately. For off-campus specialist visits, if you go to an allergist, orthopedist, cardiologist, anything of that nature, you're going to have a $30 copay. Mental health visits, $20 for in-network and with a referral. For most other services, it's a 10% co-insurance and Aetna picks up the other 90%. There is a chart on our website, and actually it's a good time to tell you everything that we're going through today is on our website. It's health.columbia.edu, and you just click on the insurance page and all of our information is there. There's a plan detail on there that'll tell you the differences between your co-insurance and your co-pays and what they'll be in network compared to out of network. You have a $60 copay for urgent care visits. And those are actual urgent care facilities, not just if you think your issue is urgent. You actually have to go to an urgent care facility in order for it to be $60 and for you not to have a referral. You also don't need a referral if you go to the ER, to the emergency room. However, that is a $150 copay. Okay. Our next term is, what is a claim? So on the next page, you'll see that a claim is the bill, basically. When you go see a physician, you will, if you go in network, they'll file the claim themselves. So they'll file the claim, they'll get paid by Aetna, and they'll charge you your copay. They collect the copay there and then usually, and that's that $20 or the $30. Sometimes they'll bill you, but generally they want that when you walk in or when you're about to leave. They will file their claims themselves. If it's a service, will you owe a co-insurance, that 10% that we were talking about, they'll usually bill you. They will send the claim out to Aetna and they'll get their 90% of that, and then they'll charge you the rest of that 10%. If you go out of network, meaning that doctor is not in, or the facility or the hospital is not in the Aetna PPO network, that requires a claim form to be submitted to Aetna directly, and that's usually done by the student. So that is obviously a little bit more documentation that you have to get, but it's a fairly simple process as well. So when you file a claim, or when the claim is filed by the doctor's office, it'll get paid by Aetna, however your benefit lies, and you'll receive an email from Aetna. It'll detail your claim and how much they paid. That is called an explanation of benefits, or an EOB. This is not a bill. We get emails from students who believe they've received a bill from Aetna and they're not sure why. We'll tell them, and it's usually written on top, this is not a bill. It's Aetna just saying, somebody filed a claim in your name for this service, and this is how much we paid, and this is how much you may owe. You don't need to pay anything until you get a bill from the provider or whoever performed the services. So new and exciting, what we've done for you this year, we created a quick guide card. It's a little wallet-sized card. It has useful resources and phone numbers, emails, definitely things that you want to keep, so that way you know how to properly use your insurance. As you can see here, this is the information that's on the front and the back. These are located, these little cards, we've distributed them across campus. We've tried to go to many of the schools. It's here in the insurance office. We've put them up in medical services. CPS has them, disability service has them. So if you see them lying around, grab one. They're really handy. I've been telling people to take a picture of them front and back, so that way if they do lose them, they can refer to them. It tells you everything that we've talked about today. Our website is on there, how to contact medical services to get an appointment. You can see the website there, secure.health.columbia.edu. That'll take you to your patient portal. You can contact your physician through secure message on your patient portal. You can make appointments on your patient portal. You can get your referral, a copy of your referral on the patient portal. If you have a spouse on the plan, they will have to call for medical services. You can call as well. So the phone number is there. Phone number is there for counseling and psychological services, SVR. It'll remind you that referrals are required for most off-campus appointments in case you forget. And it also tells you how you can access your insurance card, which is at aetnastudenthealth.com. That's probably our most common basic question that we get is, how do you get your insurance card? And how do you get your ID number? So your ID number will be on that insurance card. When you go to the doctor's office, which I forgot to tell you, they will, either when you call for your appointment, or you are there, they will ask you for a copy of your ID card, your Aetna ID card. They'll get the information and they'll do the verification of those benefits. So definitely have that ID card on hand. You can use their app. It's digital, so you can just store it there on your phone. There's also these phone numbers that are very important. If it's an emergency and you're off campus, go ahead and just call 911. If you are on campus, you can call public safety, who will also dispatch an ambulance if you need it. And that phone number is right there. That's all that's on that card. Like I said, it's a lot of information packed on this the little wallet-sized cards. They are floating around. So if you find one, grab one, take a picture of it. Do whatever you need so that way you have that information handy. Our email address is also there, studentinsurance@columbia.edu. You can, if you have specific questions that you want to ask us, personal health, private health information that you don't want to share in a webinar such as this, we are here. We can answer your questions, and that'll be, throughout the year. We're also here available on campus.